Hello and welcome to the EduTalk series hosted by Biotone Edu Partner Program, and massage industry experts. With the challenges continuing to face massage schools, students, and practicing therapists, thanks to COVID and its variants, the EduTalk series by Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Tonight's expert is Anita Shannon, a familiar face at trade shows and conventions pre-COVID, and a former EduTalk presenter whose talk can be found in the archive library on biotone.com. I wanted to say she was inducted into the Massage Therapy Hall of Fame in 2011 and developed Ace Massage Cupping and Meta Cupping in 2002. Additionally, Anita has published numerous industry articles and comprehensive educational videos on vacuum manual therapies. Let's listen and learn as Anita discusses effective face and neck contouring using vacuum therapy. She'll explain how it's a highly effective prep for surgical procedures and a perfect add-on to any massage session, or as a series of treatments produces noticeable, lasting results. Today, she'll share how using vacuum therapy can lift sagging skin, reduce inflammation and puffiness, and drain congestion from the face and neck. Hi, Anita, how are you? Thank you for joining us tonight.
Hi there, thanks for having me back.
Well, I will turn this over to you. And again, we ask our audience to submit questions via chat, and Anita will answer them at the end. Thanks so much, and it's all yours.
All right. Well, I don't know if many of you are using vacuum therapy in your practice yet, and I don't know how many of you really work with the face. A lot of us, as we went through school, we weren't given much on massage for the face. And you know the number of muscles in here, you know that it's all connected into the neck, all of that. Any of us that have had whiplash, any of us that clench our teeth from the whiplash or dental work or any of the other reasons many of us have jaw misalignment, sinus issues, I mean, almost anything that your clients bring in, especially in allergy season, the sinuses, are a really big deal. And if you can drain some of that pressure out of there for people, anyone who's prone to chronic sinusitis or headaches, things like that. And again, the whole face lifting and drainage, because it's super easy for all of this to back up. And a lot of us get this fullness, I like to call it my waddle here, under our jawline. Some of it is inherited, some of it's not. A lot of people who have had surgeries, thyroid surgeries, spinal surgeries, where they, access through the anterior, they did a scar is present right here. They did an incision right here. Well, this is some of the main drainage from superior to the clavicle and through that central clavicular notch. So one person I'm working on right now, I'm working on softening up some of that scar tissue in there and allowing this to come and be drained down. I've had two people come in that actually, they're now in their 40s, 50s. One of the women is in her 60s. They were born with their umbilical cord wrapped around their neck. And amazing, you can see the imprint of the umbilical cord and how it's all backed everything up into their face and their neck. Around the eyes, we tend to get a lot of congestion around there And it's really fun when you get to do this on somebody and see their eyes open up again. So that kind of leads us into the pre-surgical applications. If somebody's getting a facelift, why would we not drain the face and really get the lymphatic system going for them prior to that surgery? It doesn't make a lot of sense to me to go in and do a surgical procedure on somebody when their lymphatic system isn't working correctly already. So the surgeons really like us. Very little bruising afterwards, very little puffiness. They drain really well. And we've already really gone in there and stimulated the skin because we're bringing circulation to the surface. We're draining the lymph. We're softening muscles, you know, again, looking at hypertonicity and tonicity. So you've got one muscle that is flaccid, which is the hypo, and one that is hypertonic and tight. So that could pull somebody's jaw off. It could wreak all kinds of havoc. And in surgery, that's kind of important. So we can balance a lot of that out so that the surgery goes really, really well and the recovery goes even better. And then after recovery, when the doctor says it's okay for me to go back in, just make sure that the lymph is still draining and everything's good. So the pre and post surgical applications are huge. But I get to work on a lot of people who aren't even considering surgery. They just look in the mirror all of a sudden one day and their mom is staring back at them, or their dad. Both of my parents, for some reason, had a lot of fullness as they got older under their jawline. So I've been battling that myself. And that is taking a lot of drainage. Along with that, I have TMJD. So I clench, and that tends to keep my drainage from going through what Bruno Chickley calls the water wheel, right here under the ear, all right, just kind of anterior, but inferior to the ear. This is where a lot of the lymph comes and is processed to go down the neck. You know, there's node chains all the way under the jaw. There's node chains down the neck, and then there's node chains superior to the clavicle. So if somebody's clenching, a lot of that gets blocked, and then they end up with a lot of puffiness in their face, backs up around their eyes, all of that. So it is so much fun to release that for people. And I'll show you a little fun thing for TMJD that I do for myself and my clients. I figured tonight might be really fun just for me to do a demo on myself so you guys can see how this works. When I'm being really good to myself, I maintain in my shower with a cup. And I might do that a couple times a month. If for some reason I'm having sinus issues or I'm getting really puffy for some reason, I might do it more often. Please don't ever do this more than 2 to 3 times a week. If you do more, if you started doing drainage every day, you're going to override the lymphatic system and really mess things up for people. So give it that 2 to 3 days in between for their lymphatic system or your lymphatic system to catch up and drain and get to the point where it's like, okay, we need to remove the next layer of debris. So this is what I use in the shower. You can get these all over the place. We'd like to call it a witch's hat. Also kind of looks like a traffic cone. My favorite thing, because I love everything Egypt, is to do kind of the pharaoh look here. I do have a lot of fun with this in the shower. So you can do suction and release with the silicone. And the nice thing is I've got my facial cleanser on in the shower. So I've got my viscosity, I've got everything I need. So you're going to need to start a course superior to the clavicle and start draining over. And this is going to be a suction and release. So you're kind of pumping it and releasing. So the movement with this is squeeze it, create the suction, and then squeeze it again, but don't let go till you get to the next place. I'm demonstrating lower down just so you can see the movement. So squeeze it, lift up, come back down. If you don't let go in between those, you're going to be very successful. If you let go, you're going to be double squeezing, and that's going to really hurt your hand after a while. So just come, you know what, I'm just going to get the hair back here. In the shower, I don't have to worry about this, of course, because my hair is either wet or back anyhow. But just so you guys can see better. So you're going to start down the neck. If you find there's a lot of congestion here, start above the clavicle first. Drain to that central clavicular notch and then down through. Then you come down the neck. So you're always going to be draining, no matter what you're doing with vacuum therapy. If you're doing lymphatic drainage, you're going to be clearing proximal before you bring distal down. So if you started up here on somebody and you started moving all of this to the side of the face, it's going to get caught right here around that temporal indentation, because none of this got drained before, and you're going to end up with a big blockage right where you want the best drainage to be. So pre-drain the neck. If you're doing it with manual, please do one side of your face in the shower, then do the other. Because if you came across and you did this nice suction and release down the neck through the central clavicular notch, come back a little further, stay superior to that clavicle always, and through the notch. Now, if I came over and started doing that over here, I might start drawing lymph in that direction. If I do the whole side of my face, then I come over and do the other side. By the time I've gotten to here, it's been about 10 minutes. It took me to work all the way up. Now with the machine, you can do it with 2 cups at once. And basically you can do both sides at the same time. But again, don't take your machine in the shower. I know I didn't have to say that, but you never know. Please do not take your machine in the shower. The nice thing with this though is it works really, really fast. So I'm coming down both sides of the neck with the pumping movement, superior to the clavicle, and then through the central clavicular notch. So what we're going to do, we're going to be sending you a little handout. We have a chart for the drainage, but we also have one that's really fun, a facial zones and points chart. And there's not too many of those out there. You're going to see one for Ayurvedic. You're going to see one for Chinese medicine, actually quite a few for Chinese medicine. Everyone's got a little different one. This is a chart I put together from different sources and my own experience of doing skincare. Right now, it's been almost 40 years of what I noticed about people. And then I started correlating that to other charts. So on the neck here is nervous system. You're coming right down those SCMs and scalenes, and anyone who has nervous system hyperactivity, you're going to usually find soft tissue very tight in the scalenes and along the SCM. Any of us who clench our jaws, you know our SCMs are going to be like a rock. So that's where this comes in really handy, is I can come right down the SCM and really loosen that with the pumping. So I'm going to turn the machine on. Hopefully it won't be loud. And then I'm going to put it on a pumping mode. So every time it pumps, I move down. A lot easier on your hands than the silicone one. So for my clients, I always use the machine. For myself, I use the silicone one in the shower. But this makes it very, very, very easy. So each section has 3 movements, and it kind of comes out in a cone shape here and then clears. So remember, with the machine, you can do 2 sides at once, or you can do 1 side at a time. What's really fun the first time you work on somebody is do 1 side at a time and then show them the difference when you've got 1 side done. It's really funny looking. Many of them look like a Picasso. And it's really nice for them to see that there is a real difference. So your second section is going to be this under the jawline area. And you can do pumping or you can do gliding. First time, I very often stick with pumping with people just to make sure I don't have any issues with, weak capillaries, things like that, any kind of damage. I like to go with the most gentle treatment I can. Now, after each section, you've got to come down that neck again once. This is just really nice. It does it for me. So I'm just going to turn the pumping off. See how much suction I've got on here. Whoa. Okay, test your suction so you don't suck somebody's sinuses out through their face. And turn it down. I like to use fractionated coconut. I have a feeling Biotone has also a lot of special products for the face. I haven't investigated that. I think I got stuck on the plain and simple. So just to make this easy, we'll take glasses off. Very often people come in with makeup. As massage therapists, we really should not be taking makeup off of people. So if you're not licensed in aesthetics or skincare, just send them to the restroom with some of those cleansing cloths. Works great. And if anybody has any issue with fractionated coconut going on their face, ask them to bring their own cream or something. I've been doing skincare for almost 40 years. Fractionated coconut is water soluble. I actually use it as a moisturizer. It works really, really well. And it's going to help. It's got great viscosity. You get to do your treatment, and notice I'm actually applying this in the orbit under my eyebrows. I am putting some of the coconut on there. Just for ease, I'm gonna just do one side at a time so it's easier for you to see. And let me test that. Strong stuff. So I'm just going to show this again. Please make sure that they aren't hyperextending their neck, then that tightens everything up. Or if you're doing it on yourself, don't hyperextend your neck towards the. So just kind of anchor it with your hand and do a nice glide. Then I use my finger to release that. So I'm doing that under the jaw area again, just to show you this can be done with a glide. The only thing I ask is please don't glide down people's necks because you could be opposing blood flow. So as you come down the neck, turn my hand so you can see better. I'm using my finger, kind of pressing away. So I don't know if you can see that, press that away to get the pumping movement that I want instead of turning the machine again. Your next section is going to be along the jawline. This will be fun. Let's see if we can get an asymmetrical on me. Other fun stuff this can be used for, all the way back to the jaw there. Just a little glide down into this area here. You can actually feel some congestion in the eustachian tube there. Don't be afraid to stop what you're doing and work that down. So other applications include eustachian tube congestion. You can help small children. You can use these little teeny tiny cups for work like that. Or you could even use a medicine dropper. Just take the cap and everything off, put the small end into your tube. You've got a perfect cup for working with babies and children in this area. People with eye surgeries, people who have had lazy eye surgery, then all of a sudden now their lazy eye got fixed and is only going in one direction. You can soften all of that up for them and their eyes will often start tracking together. The only limit is your imagination. What can I use this for? Now we've affectionately called this sucking face. I don't know if you can use that in advertising. I don't. But it is something we can giggle about with customers that we, clients that I know really well. So again, I did this section. I have to come down that neck one more time. Again, pumping only. So here is our next section. So we've done one section, two section, three section. This is number 4. You can see I've got deep lines. Now I did smoke. My sister never smoked in her life. She has the same lines. We both were used as kind of test subjects in the 60s for new dentistry. They didn't realize when they moved people's teeth back that some of the lip structures and things kind of collapsed. We found out. Now, one really neat thing you can do is we have these cups with little holes in them. They have a, you can see that, there it is. Has a little hole, so I can do my pumping with this instead of having to use my finger. These are really cool. So I can come in, go right over that line, go in the same direction. And when I want to release, I just let that finger, oh, sorry about that. I'm going to use a different finger. Let that finger go. Maybe I'll try the index finger. There. Sorry about that. Did not mean to give you the wrong finger there. And again, anchor it and move over. Now, something that's really fun, if you want to do it for people, is lip poof. And there are actually specially designed units out there now shaped like the lips that will poof them. It's so funny looking. They actually had that on some show where they were laughing at stupid inventions. But this actually does work. Just really get them in there, get some blood and circulation in there. Now you notice after 4, I didn't drain down. That's because I'm going to catch that on number 5 now. The other thing you can do is use a bifurcated hose and use your finger to release. Like right now I'm doing section 5. That's how I'm releasing the cup. It's right here. I always like to anchor for people, just so they don't feel like I'm tugging really hard on them. I don't know about you, but are you seeing, I'm actually seeing a difference in the sides already. Cool. Nice thing is, over the next 2 days, it'll get even better. So you do want to do the 3 movements 3 times. And remember, I'm releasing here. Now I'm going to come down the side, grab everything, and then suction and release. So again, I'm using my finger to do the release from here. It makes it super easy. Now you can do this with manual cup sets too, with the pistol. Get really, really tiny little cups for it. There's all kinds of neat stuff you can do. All right, my next favorite place is right here. I did this once on one of my clients. Remember, we've been doing this vacuum work in facials since the dawn of dirt. I mean, when I started out in the 80s, they trained us in doing vacuum. Most, 8-in-1s and other equipment have a vacuum unit. Most estheticians don't really know what they are anymore. For massage therapy, this is a great way to approach the face. You don't feel like you're pressing on somebody. You're not damaging the skin in any way. It's nice, it's pink, it's stimulating, it's drained, it's lifted. You're working the musculature if you're going deeper. If you're staying superficial, you're working the lymph. But this spot right here, you're going to see in the chart we send you, this is liver. So you often see quite a few lines in that area on people. In Chinese medicine, the lines mean wisdom. It's just a lovely way to look at it. And for other people, you can see disturbances in the liver. Now, if you get a little, I got some scarring from going through some windshields and car accidents, so I'm doing a little twisting there to get it up there. Next section is coming across the forehead. And notice I'm lifting off right here, so just slow down. Might be an old impact, an old scar, or it could actually have to do with my small intestine. So this up here is small intestine, colon, got your heart, you've got lungs here. So very often when you see somebody with rosacea, they very often also have a chronic lung issue. The facial zones and points is really for us massage therapists. We get to really look at the face, see what might be going on, kidney and adrenal under here. You know, if somebody's got dark circles or, you know, big pads under the eyes, something's going on around the kidneys and adrenals. We're not here to diagnose, but what a great assessment tool. You know, I can look at somebody and say, isn't that interesting? And then I look along a meridian, there's a discoloration in the lung area. Well, isn't that interesting on the foot? That's a very painful spot in the lung. So once I check it 3, 4, 5 times, it's like, okay, we've got something going on, lung or liver or wherever it is, or small intestine, colon. It's really fun. It's great information for us. I have learned not to blurt things out to clients because I scared somebody one time. So I learned to, you know, keep it in my notes and use it for further observation unless it's something I feel they need to see a physician about. This feels really good. So can you imagine what this does for headaches? Tension headaches especially. My specialty was migraine. So I do a lot of work with people with drainage and, you know, working along the migraine, with the migraine issues they may have. And again, I'm using this to release the cup. Oh my gosh, there is a difference. That's cool. All right. Now my favorite part is the eye. So people are really, really worried about us working around their eye. So in the chart we send you, it has little X's, things like that, but you will see me do a glide up here on my eyebrow. So under the eye, you're gonna get right in there. You can see that I am right on my eye, inside the orbit, but I'm not on the eyeball. I can feel it pulling on the muscles of my eye. And very often after I do this, my eyesight gets a lot better. So just think of it. As we get older and the muscles atrophy on the lateral sides and then get hypertonic, superior and inferior, that's going to change the shape of our eye, which is why many of us need reading glasses. I mean, just with doing this, I kept the same reading glasses for almost 10 years. We can cheat it. We can cheat aging, I swear. And up here, again, anchor it. Let them know you're coming. And I am doing a glide. I'm going right over to the side here. And then releasing it. This actually feels amazing. If you have the machine, especially the M600, I'm at about a 12 right now. All right, I'll have to do the other eye later because now I'm seeing funny. And one really nice thing to do after this is to lift the eyebrow. So I actually come in, lift it up, place my cup, and just hold it. When I used to do facials and I was trained by European facialists in the 80s, we did this with pinching. We pinched the eyebrows. You know, this was our way of lifting them like this. This actually feels a lot better than the pinching. And again, you can do a nice glide. If you see that you're coming off, do a little twist, because very often it's sinus issues right here, especially, that will kind of glue. Now, a lot of times we get questions about Botox and injectables. Please, if someone has had an injectable, don't go near them, you know, for at least a month or 2. With Botox and all of those things, well, let's go Botox. With Botox, the goal for us is to drain out the old Botox because it spreads unevenly. And then after multiple injections, that's why they can't get any more injections, is it's just so massed up in there and so uneven that they start getting an uneven kind of texture. So what I do is in between their shots, let's say they've got about 4 weeks before their next shot, that's when they come in to me twice a week for 2 weeks, and then 2 weeks, maybe once a week. We drain all of that old Botox out. The thing that I find that it did is it burned all the layers together, kind of fused them. So we're able to open up all of the layers of the tissue again. Now, Restylane, all the other injectables, things like that, I wouldn't go near, because those are not like Botox. Those are actually fillers. You don't want to move a filler on somebody. If they are going to get fillers, or they're going to get some of these different procedures, please get to them beforehand, before they go for their appointment, and prep them for it. Because nothing's better for these things to spread evenly than for us to open the tissue up, get all the old lymph out, and get all that stuff out. If you have any questions, if somebody says, I just had Restylane or something done, or I had Restylane done 6 months ago, look them up. There is so much information on the internet. But as massage therapists, what we can do for people for TMJD, I'll show you in a second, for just lifting and draining for chronic sinusitis. None of us wants to see that crepey neck. I just had my 60th birthday, and I actually treated myself to a couple different facials. I'm getting some IPL things, and went and got a hydrofacial. And the fun thing is she was penetrating a lot of these different products, but she was doing vacuum on me the whole time. So I was like, this is so cool. It's in everything. You're going to find us sucking face in quite a few procedures in the aesthetics and in the medical field. As massage therapists, our focus is also lymphatic, muscular, and skin. We aren't applying products to enhance their skin. That's outside of our scope as massage therapists. But we are doing quite a service for them. For myself at home, when I've done this work on myself, of course, then I do take the residue of the oil off. I mean, I only put about 6 drops on my whole face, but I just picked these up from a company. I have a feeling Biotone might have skincare products and things too. They might even have something similar to this, but like collagen lip plumpers, little neck wraps. Here's one for the eyes, things like that. So once you've done this for yourself, especially, or unless you are licensed to do this, you can apply really neat stuff. It penetrates extremely well, because you've got all of this dilation, vasodilation at the surface, and it just starts pulling everything topical in. So ampules, masks. I had the good fortune to visit the Dead Sea for the first time in my life this year. I've been using Dead Sea products, so I tested it out, did half my face with the vacuum and then half without, and tested, what I saw with the Dead Sea products. And I just started with the water, and within about 5-10 minutes, it had all been sucked in on this side, and it wasn't. There was still some surface on this side, and I put, of course, the equal amount on. Have fun with this, test it, especially on yourself, and see what happens with different products, with different, do half of your face and see what happens. Get up the next morning and see that it lifted even more. So if your face is a Picasso after the treatment, it's going to be even funnier the next day, because it will actually start lifting and draining even more. So have fun with this. Test it out on your clients. One of our practitioners, just checking my towel. Good. Okay, I'm not going over. One of our practitioners did a health fair, and she set it up with just one of those wonderful recliners for people. And she did half their face. Some people wanted their feet done instead, so she did half of the plantar fasciitis and other footwork. And the third day of the show, she couldn't fit any new demonstrations in, because everyone she had worked on came back and said, please fix my other side of my face or my foot. You can do some really fun stuff, but do this. Really do half a face for free, and really let people see the difference. Because if you do their whole face, they may not see it. The other application is special events, prom, weddings, all kinds of stuff. Because if you can do lymphatic drainage like this on the face and lifting, imagine what you can do for the whole rest. We've helped some brides get back in their dresses without alterations, things like that. And again, everyone has to live with those photos for the rest of their life. the parents, the siblings, everybody in those photos has to live with it. So I've always had a lot of fun with wedding parties, you know, twice a week, that week before, you know, the wedding. They come in once or twice, however much they can do, and we just do. Then they all we do the face lifting and drainage, and any of them who need the body, we do the body contouring, and they all are really happy, you know, because you just look your best, and that's what we all want, I think. So I hope that was clear on how to do it, and I think we're probably going to go for questions now.
Hi, Anita. I saw two questions come in, and the first one is, how many days ahead is it safe to do vacuuming before a surgery?
Aha. I would say I would do it 2 to 3 days before, just so the lymphatic system has time to fully process it. So I would go about 2 days before.
Okay, and then Teresa, I do cryptofacials. Is it better to cupping before the cryo? Can you never do cupping on someone that has fillers?
It depends on which type of filler. There are so many different ones. We'd have to talk about each one separately. The cryotherapy, when I teach massage cupping and everything, the one thing I ask is please no extreme temperatures after, no freezing and no excessive heat. It can be done beforehand. So I'd be curious about doing in the cryofacial, maybe doing the cryotherapy before you do the vacuum work.
And then would you do that in the same day, the same session, or give your body?
If possible, I would separate them. You know, just because if you do the cryotherapy right after the vacuum work, you basically snap all of those blood vessels shut again. If possible, if they could be done on opposing days, that would be the optimum. But if not, try it both different ways and see what you think. Since I don't do the cryofacials, so that'd be hard for me to give an opinion.
Okay. What do you do for TMJD?
Yep. Thank you. That was the one I forgot. All right. I just get babbling and I forget. Okay, so we have a make sure my clamp is off. I have clamps on my hoses so I can go single or double. I love these things. Make sure I have enough suction. Don't want to suck the jaw out through. All right, there it is. So you've got the jawline here. I'm going to start just at the top of the mandible, pull out, open and close. Detach it. Next, right down just anterior to the ear, pull out, open and close. Last one is going to be right at the curve. Watch out, this can hurt because pterygoid is in here. So go ahead and put that on there, pull out, suction and release. Feels amazing. And do make sure you go down the SCMs and make sure you address the posterior neck, because most of us with TMJD, usually we've got neck issues from either fractured vertebrae or from whiplash. So try that on yourself. It feels amazing. And be very, very careful that you're going to feel people's jaws popping and stuff underneath you as you're pulling those cups out.
Very interesting. Where do we find the face mapping chart?
Aha! We will be sending that to you. We tried to put our information on it and I'm technologically challenged and it kept wiping out half of our website. So I'm turning that over to my IT department tomorrow and we always get a list of all of you. We're going to send that out. This is neat though. Can you see the difference on the two sides? I can see this like blob here that isn't here anymore.
It's visible, yes.
Is it?
Yes.
Cool.
Can you, I want to get back to this one. Can you never do cupping on someone that has fillers?
I would research each filler and realize that
Okay.
you're moving material. I will not go near a filler that is anywhere under 4 months. And even then, I still have to research, because even the fillers I thought I knew, they've changed the formulations. Those are, yeah, you move somebody's filler out, they're going to be really unhappy with you. And again, we don't know what we're releasing into the body. There's lots of questions and lots more research I need to do on all the fillers.
All right. Could you add microcurrent with cupping?
Yes, most definitely. Yeah, I would do the vacuum therapy first, and then I would do the microcurrent, because now you're working on really lifting the muscles, and you already did the drainage and really stimulated the skin. So the microcurrent, yeah.
All right. Now, do you clear the neck area before TMJD treatment?
If they have a lot of swelling in there, I would definitely do it. I think it's just become such a habit for me to pre-clear the neck no matter what. Make it a good habit. Yeah.
Good advice. Are the manual cups just as good as the vacuum cups?
As the machine ones?
I'm guessing that's what they mean.
Yeah. I mean, you can't get as much suction, but they feel great. And again, this is what I use in the shower. So, it just takes a little more work, but I love this. And again, I always keep manual cups around. You never know if your power is going to go out or something. And I always want to be able to work on people. So even these little guys that I was showing you on the machine, we have little bulbs you can get for these and make them into a manual set. So I always keep a few extra bulbs around, that if anything happens to my machine, you never know, somebody trips over it, I drop it, power goes out. I've got my manual sets. They work great.
All right. I saved this question for the end, which is, where can you purchase this equipment?
Massagecupping.com. We've got everything there, and staff is always happy to answer your questions. We want you to get the right equipment. Yeah. And that will be on the handouts and things we'll be sending you tomorrow. The website will be on there, so you know how to get a hold of us and how to look.
Okay, and can the manual cup do an effective job on TMJ as well as the machine?
It can do a good job. Well, if you've got the ones with the gun on them, see, this is limited. It can only take in enough suction of the size of it and how hard I can squeeze it. If you've got the manual ones with the pistol, those two smallest ones, you can get those on there really well. But with this one with silicone, you're limited. I mean, it's only got this much strength. I can squeeze it twice and get a little more. It's enough. I mean, yeah, something just popped in there. But if you find you're doing a lot of the work, you might end up grabbing the machine after a while. You start out slow and then build up.
Okay, and lastly, you were wished a happy belated birthday.
A big 6-0. That was cool.
That's right, but you look 39. So.
Well, I had saved up for a long time, and my bucket list from when I was a little kid was to go to the pyramids in Egypt. So they were taking us through all these different beautiful temples and everything. And I was looking for one thing, and it was the cups, because there's a carving of the cups on one of the temples. So the whole place had to deal with me screaming and yelling when I found these carvings of the cups on the side of this temple, Como Obo. High point of my trip.
Wonderful. a birthday to remember.
Yeah.
Well, thank you so much, Anita, for sharing this good information. And just quickly, I will do a follow-up email tomorrow with a link to the recording, and Anita will send out the facial mapping information. If not tomorrow, it will come over the next few days. Let's see. Additionally, Biotone has coconut products on their website, so please check biotone.com. And our upcoming EduTalks are October 26th. We have active myofascial therapy by Irene Diamond, and she'll discuss it working on the neck. And then November 9th, where's this year going? November 9th, Career Pathways with Sandy Fritz. And I think that will be excellent to know what there is that massage therapists can take advantage of to build their careers. You have many, many thank yous, Anita. And lastly, I mean, if our audience wants to reach out to you, I know I'll have your contact information in the email, but is it best to go through one of your websites?
You bet. I mean, anyone you want to contact in the company, I'm Anita at massagecupping.com. There's info at massagecupping.com. You can't go wrong. Yeah. Yeah. Feel free to email me. It may take me a day or so to get back because I opened my practice again, not seeing as many people, but it's so nice to just be working again.
No kidding. I think everyone feels that way to do what they love to do. So thank you so much, everyone. Watch Anita's previous Get Sucked In EduTalk on biotone.com under blogs and events page, and join us for upcoming talks. Thank you. Take care. Bye, everyone.